Hello, it's Pseudo Dr. Henry Pseudo DDS here. I'm here to talk about brushing your teeth. Today I'm going to show techniques. Let me tell you about the toothbrush I prefer. The reason I prefer it is because when you cut plastic, it can have a sharp edge, and you don't want a sharp edge on your plastic bristles. So Oral-B, I know, is a good product. Excuse me there. Oral-B has a good product that has rounded tips, and each bristle won't be as abrasive or slice through your gums, affect you in that way. So that's one thing. The next thing is the way you brush. I like to think of every tooth and spend a little time on each one, on all the surfaces. So you are a three-dimensional being and have you have four sides that you need to deal with, and flats on most of the back teeth. And so you have to think about the dimension of the tooth. And in brushing, I like to begin up at the gum. I'm thinking about the gums being pulled down between the teeth when I brush. So I don't want to be real tough on the gums, but I do want to stimulate the blood flow into the gums. So I put it up at the gum, and I do little swirls above each of the teeth. You have every tooth to deal with a little bit. But after the swirl, I don't do a whole lot, just enough to stimulate, and then you pull down. You want to pull down the gum in between your teeth. You'll guide it into its growth pattern. Also, your teeth have actual growth lines in the enamel, the outside of each of your teeth. So you want to guide down through between the teeth also in your brush stroke. So you're pulling down the gums between the teeth and following the growth lines of the enamel. So on the top, you're doing that down. On the bottom, you spend some time on your gum and up. And you're doing it on all sides. So in the back. And I'd concentrate on some of these corner areas on the back. I do a little, against the grain sometimes, but if I do, I always want to come back and do a little bit of pull the gum back into place. So surfaces, I do that on the surface of the back teeth. Right? All surfaces of the back teeth. And behind it, all the way to the back, there's a spot behind your back molar or furthest tooth back, whatever you have. Wisdom, I had mine removed. But there's the back tooth. And it has some collection that you have to focus on, and you want to be drawing it up and as well. And then we talk about the tongue. I have a tongue scraper. This one has a little tongue texture, so I have some toothpaste left over from when I brushed her before this video, but you get the idea. Okay. Eat an apple. Keep your pH in your mouth appropriate. You can even use your 9.5 pH, swishing it around. It's not real important to have some toothpaste on your toothbrush in your removal of if you use water, of your plaque. So don't let that be an excuse not to brush. But get yourself baking soda peroxide if you need to. It's cheap in bulk and it does the same thing. Spit all your fluoride toothpastes out and rinse them well. If you have a fluoride toothpaste, you can rinse it or and use it as mouthwash. But use mouthwash if you'd like to with fluoride. But again, protect your pineal gland by rinsing it out as much as you can afterwards, and realize it was a surface, internalized area that you're using, a kind of a surface cleaning. So you can remove metals also for if you have a filling like amalgam of silver and lead, which slowly can, in chewing and brushing, be abraded slightly and be evolved in your mouth. You also want to wash and spit out as much of that out as you can. So remember what you've just brushed off too is still kind of floating there, and you want to rinse it as many times as you can. And then for an hour, give your teeth a break and let the fluoride sit on them, or the cleaning agent sit on them, and then be clean. And eat good foods so that you're not taking the calcium out of your teeth. Don't drink too acidic drinks for too often with it, and don't let the feeling of things on your teeth stay there that long. You can always find a toothbrush, and if you don't have a toothbrush, you can use a piece of cloth or even a paper towel and rub down from the gums in the same direction you would with the toothbrush. Well, those are my advices, and be good to yourself.